Imagine feeling perfectly fine one day and then suddenly, you're hit with a strange illness. You visit the doctor, they take a blood test, and then you hear about something called atypical lymphocytes. What are these cells? Why are they showing up in your blood? What do they mean for your health? The answer can be confusing, but understanding atypical lymphocytes could help you get a clearer picture of what's happening in your body. These unique cells are a powerful part of your immune system, fighting off infections and keeping you healthy. But high levels of them could signal a more serious issue. So, let's dive into what atypical lymphocytes are, why they appear, and what they could mean for your health. Section 1. What are atypical lymphocytes? First, let's break it down. Lymphocytes are a type of white blood cell in your immune system. There are two main types, B lymphocytes and T lymphocytes. B lymphocytes are like your body's security guards. They produce antibodies that lock onto invaders like viruses and bacteria, neutralizing them. T lymphocytes, on the other hand, are the body's direct fighters. They destroy infected or cancerous cells and help regulate your immune response. But sometimes, your lymphocytes change shape and size in response to an infection or disease, becoming atypical lymphocytes. When this happens, these cells can look different, behave differently, and play a vital role in fighting off infections that might otherwise overwhelm your immune system. Section 2. Why do atypical lymphocytes show up? Atypical lymphocytes appear as part of your body's defense mechanism, especially when you're dealing with infections. Picture them as elite soldiers that activate and expand when your body faces a tougher battle. When your immune system detects a significant threat like a viral or bacterial infection, it sends a signal for help. In response, your body produces more lymphocytes to fend off the invaders. Some of these become atypical lymphocytes, cells that transform to be larger and more flexible, ready to take on the challenge. For example, infections like mononucleosis, which is often caused by the Epstein-Barr virus, lead to a surge in atypical lymphocytes. Even with COVID-19, healthcare professionals have observed higher numbers of these unique cells as the body responds to the virus. Section 3. What high levels of atypical lymphocytes might mean. If your blood test shows high levels of atypical lymphocytes, it could be a clue that your body is fighting something more intense than a minor cold. The most common causes are viral infections. These are among the most frequent reasons for increased atypical lymphocytes. Viruses like Epstein-Barr, cytomegalovirus, or even COVID-19 can trigger this. Bacterial infections. Although less common, bacterial infections can also cause an increase in atypical lymphocytes. Chronic lymphocytic leukemia, CLL. This is a type of cancer where your body produces too many abnormal lymphocytes, including atypical ones, that crowd out healthy cells. People with CLL might not notice symptoms initially, but blood tests can reveal elevated lymphocyte counts. If left unchecked, these cells can weaken your immune system's ability to fight infections. Section 4. How do you know if you have high levels? So, how can you detect atypical lymphocytes? Typically, doctors will use a complete blood count, CBC, test. This test provides a detailed look at your white blood cells and can show the number and type of lymphocytes in your blood. For even more accuracy, doctors might use flow cytometry. This test is like a fingerprint scan for your blood cells. It can analyze each type of lymphocyte and highlight any atypical ones, helping doctors understand your immune system's current state. When you go for these blood tests, you might have to follow specific instructions, like fasting beforehand. Your doctor will give you all the details so you know what to expect. Section 5. Understanding your results and next steps. After you get your blood test results, your doctor will interpret them. But here's the catch, there isn't a universal normal range for atypical lymphocytes. Generally, most people have some atypical lymphocytes in their blood. However, if your overall lymphocyte count exceeds 4,000 per microliter of blood, this could be a sign of lymphocytosis, which is when your lymphocyte count is higher than normal. Having high levels of atypical lymphocytes isn't always a reason to worry. It often just means your immune system is actively fighting off an infection. However, in some cases, especially with elevated counts, it could be an indicator of leukemia, like CLL. Section 6. When should you see a doctor? Knowing when to consult your doctor is important. If your blood test shows elevated lymphocyte levels and atypical lymphocytes, here are some symptoms that may signal the need for a closer look. Persistent fatigue or weakness that doesn't seem to improve, unexplained weight loss, frequent infections or fevers, swollen lymph nodes. Even if you don't have symptoms, high atypical lymphocytes on a blood test should prompt a conversation with your healthcare provider. They can help determine the cause and recommend the next steps for you. Conclusion: the takeaway on atypical lymphocytes. Atypical lymphocytes are more than just a scientific term on a lab report. They're a key part of your body's defense team, activated during infections and sometimes when facing more serious health conditions like CLL. Understanding these cells helps you stay informed about your health and empowers you to take action if something seems off. Remember, if you're ever concerned about your blood test results or feel like something is wrong, talk to your doctor. Your body is always communicating with you, and with the right knowledge, you can better understand its signals and take control of your health. Thank you for watching. Stay informed, stay healthy, and remember to subscribe for more videos like this.